What's the difference between RA and OA joint surgery? When it comes to joint surgery, many people wonder about the differences between surgeries for rheumatoid arthritis and osteoarthritis. Understanding these differences can help patients make informed decisions about their treatment options. First, let's look at the diseases themselves. Rheumatoid arthritis is an autoimmune condition where the body's immune system mistakenly attacks the joints. This leads to inflammation, joint erosion, and deformities. In contrast, osteoarthritis is a degenerative disease caused by wear and tear on the joints, primarily affecting older adults. It results in cartilage loss and bone rubbing against bone, but it does not involve systemic inflammation. Now, let's talk about the complexity of the surgeries. Patients with rheumatoid arthritis often requiring more intricate surgical procedures. This is because their joints may be severely deformed, and the surgery may involve removing damaged soft tissues and inflamed synovium. Sometimes, additional procedures like soft tissue releases are necessary to correct joint contractures. On the other hand, surgeries for osteoarthritis are generally more straightforward. They mainly focus on replacing worn cartilage and bone without needing to address extensive inflammatory tissue. Both groups of patients may undergo partial or total joint replacement, commonly in the knees and hips. For those with rheumatoid arthritis, surgery is usually considered when medical management fails and joint damage leads to significant disability. In contrast, patients with osteoarthritis typically explore surgical options after conservative treatments, like physical therapy and injections, no longer provide relief. Postoperative risks also differ between the two. Patients with rheumatoid arthritis face a higher risk of complications such as infections and wound healing problems. This is partly due to their immunosuppressive treatments and the systemic nature of their disease. In comparison, osteoarthritis patients generally experience lower risks of infection but may face higher risks of cardiovascular events after surgery. Therefore, careful preoperative medical optimization is crucial for those with rheumatoid arthritis. Recovery can vary significantly as well. Patients with rheumatoid arthritis may have a slower rehabilitation process and longer hospital stays due to multiple joint involvement and the effects of their systemic disease. Conversely, those with osteoarthritis often have a more predictable recovery trajectory focused on the single joint that was replaced. Finally, let's discuss costs. Joint replacement surgeries for patients with rheumatoid arthritis tend to be more expensive. This is due to the complexity of the surgery, additional treatments needed, and longer hospital stays. In contrast, surgeries for osteoarthritis are generally less costly and involve fewer complications. In summary, while both rheumatoid arthritis and osteoarthritis can lead to joint replacement surgery, the surgeries for rheumatoid arthritis are typically more complex and carry higher risks. Understanding these differences is essential for optimizing surgical outcomes and managing expectations. Always consult with healthcare professionals for personalized advice tailored to individual medical needs.